among them is trypanosomiasis, mange, ectoparasites, and endoparasites. These are important parasitic diseases. The trypanosomiasis and mange, this is a worldwide problem, and not only in India but in other countries also. Though the uh, level of endoparasites means roundworms or tapeworms, they occur in lesser intensity in camels because uh, for transmission of their eggs, usually humid conditions are required, and the camel is a usual animal of arid zone. Then among viral diseases, two important diseases include camel pox and contagious ecthyma. I think this is only a small list. The camel is also susceptible for many other viral diseases, and their distribution varies from one geographical area to another. Then among bacterial diseases, brucellosis, tuberculosis, and pasteurellosis, they are very much important, and I think they are prevalent in almost all camel rearing countries. Then some miscellaneous conditions like pneumonia, calf score, these are common in and of more importance in camel calves. Then regarding trypanosomiasis, it is caused by Trypanosoma evansii, and this disease is also known as Tarrati Barsa in India, and Murina malde cadavers, and some bits some other names in different countries. And this is a classical and historical disease of the camel that was discovered by Griffith Evans in year 1880 in uh, Dera Ismail Khan districts of the Punjab state. Classically, the trypanosomiasis, they are very much important in case of camels, and another species is equines. So for these two animal species, this disease is very important because it even after the treatment there are uh, fair chances of reoccurrence, and if the animals are not treated or even sometimes after treatment, mortality occurs. Then the vectors include hematophagous flies, particularly Tabanus, Stomoxis, and CC fly in some African countries. They are very common. But for India, Tabanus is the most important fly. And some these vectors, they mechanically transmit these parasites from infected animal to a susceptible host. And when for only limited time, they survive in the mouth parts of these flies. And before that, if it is transmitted to any susceptible host, then only the disease occurs. So the prevalence of trypanosomiasis also varies with the different seasons. When the vector population is high, there are in high chance of transmission. When there is a low vector population, then the incidence will be low. Next, please. So this diagram or picture is showing the different vectors of this trypanosoma, and this blood smear is showing the trypanosoma parasites and the elliptical RBCs of the camel. Then the symptoms of the trypanosomiasis is very vague. This is a chronic disease which is often evident in the form of mild recurrent fever. There is weight loss, abortion, then decrease in the draught power, then dependency or edema of the dependent parts, arterial plaques, then circular movements. But these nervous signs, they are very rarely recorded in camel. Then these clinical symptoms, they are often confusing, and only on the basis of clinical symptoms one cannot identify the disease. Then there some of the changes in urine and fecal balls all are also suggestive of the disease. The fecal balls, they become conical and smaller in size due to reduced uh, gastrointestinal movements, and the urine becomes thicker and emits a peculiar smell, by which many of the pastoral community, they claim that they can identify the disease on the basis of changes in the urine itself. Then among lab findings, the anemia, which is often macrocytic and hyperchromic. This is a non-specific change that is reported in almost all hemoprotozoan diseases. Then this is also evident. Then there will be increase in AST and ALT values. These two hepatic enzymes, their level increases more than 25 times the normal values. Though their normal range in case of camel is also large, but still, based upon the average values of the herd, if you will consider, there will be significant increase. And this may give an important clue for the further diagnosis or further application of the further diagnostic procedure. Then plasma albumin is decreased, and those animals which die of the disease, they reveal necrotic foci in liver and spleen. Then there will be generalized lymphoid tissue hyperplasia. Next, please. Then regarding treatment, these two are the most commonly used drugs: quinaparamine prosalt, that contains quinaparamine chloride and quinaparamine sulfate in ratio 1:1.5. This salt is usually used for preventive purposes. However, for if the case is confirmed and there is heavy parasitemia, we can only use quinaparamine sulfate also. That is a curative salt, and that the drug concentration or the therapeutic concentration in blood is rapidly achieved after its administration. The total dose of the quinaparamine is at the rate of 5 milligram per kg subcutaneously, and if it may be repeated after a week of time. The single administration usually is not effective very much, so we have to repeat the injection after one or two times after a weekly interval. But the drug itself is hepatotoxic, so care should be taken. Then another is suramine. The trade name is Naganol or Monanil or Gilpol, and this drug may be given at the rate of 0.4 to 0.6 gram per 45 kg IV. But here there are some clinical symptoms like throat salivation or mental depression or anxiety like symptoms the camel may show after its administration. So the weight has to be active. So in our country, we usually go for preventive chemotherapy, and in the month of September to October, we administer quinaparamine prosalt as a preventive chemotherapy for trypanosomiasis. There are several other drugs also, and that may be applied, but the due to a smaller market of the uh, camel medicines in India, only these two drugs are available for trypanosomiasis. Then coming to bacterial diseases, brucellosis is the most important disease, I would like to say, because it is often insidious in nature, but still it is of public health significance, because many of the pastoralites, they consume the camel milk as raw without boiling, and this bacteria is often secreted in the milk. So one have to be very careful if their camel is showing abortion-like symptoms, or there are orchitis-like symptoms in case of male animals. So the brucellosis in camel is caused by Brucella abortus as well as Brucella melitensis. Both these bacteria, they are involved in camel brucellosis, and usually the clinical symptoms are not evident until and unless animal is the pregnant. In animals, in females, the pregnant animals may abort during the last trimester or last 4 months of the abortion. There may be premature birth, stillbirth, infertility, and decrease in milk production. In male camels, there are some reports they suggest that orchitis is the most common sequelae of this disease, though it may remains asymptomatic in those male animals, but they can transmit the bacteria to other susceptible females. Then regarding health, production and reproduction, these aspects they are severely compromised, and in case of abortion, one may find pathological changes in the placenta in the form of placentitis or varioversal adhesions. There may be hydrobursitis, granulomatous endometritis, and silent carriers. They are very common in case of females. Next, please. Then clinical and laboratory findings. Uh, Vague clinical symptoms like anemia, laboratory findings, anemia and leukocytosis, they are evident. And in aborted fetus, one may find subcutaneous edema, and throughout the viscera, there will be hemorrhagic uh, fluid accumulation in different body cavities. There will be mnemonic changes and degenerative changes in liver, and congestion in case of kidney and brain tissue also. So placenta is thickened, edematous, and necrosis. Necrotic lesions are present. These all changes, they are similar to those recorded in case of cattle. Next, please. Then these two diagrams showing the changes in fetus, and that was aborted due to brucellosis. So the entire visceral organs, they may show some pathogenic changes like infected fetus showing the serohemorrhagic fluid accumulation in different body conditions, body cavities, and accumulation, severe congestion of lung, liver, intestine, and spleen. Next. Then you can notice the changes in brain also. There is severe congestion and hemorrhagic changes, and kidney, they become degenerated and congested. They are smaller in size. Then for diagnosis, we often depend upon the RBPT test. Though modern diagnostic tools like PCR or ELISA, they are also available for use in case of cattle, and those can also be used for camels. In ELISA, we have to be careful that if the ELISA is based upon antibodies, then it should be for the camel specific one. So for camel specific ELISA kits, they are available in our country, and that is supplied by ICR Nivedi, Bangalore, Karnataka. Then ELISA PCR kit, test for detection of gene of the brucella, that can be applied. However, these all tests should be done with great precaution, because brucellosis is a have high public health significance. That means it can be transmitted very easily to human beings also. So handling the aborted fetus and management of the female camels after abortion, we should always take utmost care, particularly regarding to the personal hygiene also. So for RBPT, this test or reagents available for the for use in cattle and buffalo can be used, and as usual, 1 drop of serum samples is put over a clean glass slide, and 1 drop of the suspected serum is mixed, and after 5 minutes we observe for the clumping. So in case of positive animals, the clear-cut clumping occurs. The pink flakes that will appear floating over a clear fluid or watery fluid. But in case of negative case, there will be no clear-cut precipitation. Next, please. Then there are some reports that this disease can be treated effectively using long-acting oxytetracycline and streptomycin sulfate. I have taken the reference from one article that was published in OIE journal, and wherein one large herd from Saudi Arabia that suffered from a abortion storm, and the female camels, those were found positive in RBPT test. They were treated with long-acting oxytetracycline at the dose rate of 25 milligram per kg intramuscularly, then a streptomycin sulfate at the same dose rate, and the both the injections were repeated every third day for 30 days. And they claimed that all these RBPT positive females, they become seronegative after this treatment. In addition to antibiotics, they also used brucellosis vaccines containing live virulent Brucella melitensis rev strain in lower doses for therapeutic purposes. And they injected reduced dose 1 ml containing 1 to 2 into 10 to the power 6 viable organism, and they reported that this was helpful in getting cure of the disease. Then this vaccine can also be used for preventive purposes in case of camels, and the full dose means higher concentration, containing higher concentration of the organism, can be given subcutaneously at the age of 3 months to female camels only. Next, please. This is the this was all about the brucellosis, but complete cure in case of brucellosis is seldom achieved, and there is always chance of recurrence. So the if there is any history of brucellosis in a camel herd, one have to remain vigilant uh, for the on the regular basis. And same is for the tuberculosis also. These two chronic diseases, they are a complete care is very difficult to be achieved. In case of tuberculosis, just like brucellosis or trypanosomiasis, the camel becomes very big. There is reduced appetite, or the animal so reluctant to move. Gradually, they lose the bait, the ribs, they become more apparent. They separate themselves from the herd and likes to remain alone. These are the non-specific symptoms. The disease in camel is caused by both by Mycobacterium bovis and Mycobacterium tuberculosis, and this disease also have public health hazard, and so one should be very careful in handling the animal suffering from tuberculosis. Then antepartum diagnosis is very difficult, and it can be done using intradermal tuberculin testing. However, the sensitivity in camel is very low as compared to cattle and buffalo. So recently some serological tests, they have also been developed, but they need further validation. Then tuberculosis, as we have recorded in our herd, that it is more common in case of females than in males. Perhaps it is due to lactation or pregnancy stress. Then the disease is usually chronic in nature. The animals suffer from chronic sickness. There is progressive weight loss and emaciation. And if any symptom is suggesting the disease, one should immediately go for tuberculin testing. Then respiratory symptoms like coughing is usually absent. There is no coughing, no respiratory signs are usually evident. And again here AST and AKP, they increases more than 10 times the normal value. So one based upon these biochemical tests, we can guess if alkaline phosphatase is uh, very high, then one should test for the tuberculosis. Next. Then, just like cattle and buffalo, the disease occurs in two forms, pulmonary and disseminated form, though the pulmonary form is more common. And this disseminated form, they occur usually in older animals. So, in pulmonary forms, lesions, they are generally localized in lungs and mediastinal lymph nodes. Examination of mediastinal lymph node is very much important because their size increases more several times the normal one. Then there is uh, several uh, tuberculous lesions that may be evident on the lungs. The mediastinal lymph nodes are enlarged, congested, and cageated. In chronic cases, there is cageation. Then pleura and pericardium also show a small nodule. Next, please. Then one can find acid-fast bacilli in the impression smear taken from the lung and mediastinal lymph node. But here we have to careful because the bacteria may be transmitted while handling the glass slides also. Next, please. So this diagram is showing the tuberculous lesions. You may appreciate that there are several lesions on lungs, even on heart, and in D is the spleen. So there on spleen also there may be multiple nodules, and there is a difference between these nodules and hydrated cyst is that the hydrated cyst, that is also common in case of camel, they are larger in size and they contains fluid in the central part. But here there will be no watery fluid in the center. Rather than it will contain cageated material or some gritty material. So lower E, F, G, and H, they are showing different histopathological changes in different parts. Then in camel, single intradermal tuberculin testing is done by injecting 0.1 ml bovine PPD in either in the axillary region or under the tail base. These two sites, they are better because the sensitivity is high and the skin over these area, they are thinner in size. So they show the clinical changes more frequently. And third one is the middle of the neck region. Though this site is more convenient for the handlers or for the veterinarians, this site have lesser sensitivity as compared to axillary and tail base sites. So after injecting the PPD, we observe the increase in skin thickness on day 3, 5, and 7. Day 5 is the most important one, and if the animal is positive, then they will definitely show the increased thickness on day 5. However, if the intensity of the severity of the infection is very high, then animal may also show negative response. So a positive response is often suggestive that the animal is suffering from tuberculosis, but a negative test should always be looked with doubt. Once the test should be repeated after some time. Same is the case of RBPT test for brucellosis. If any animal is showing negative for the RBPT test or negative for brucellosis, one should again test after a week or after a month. The test should be repeated because sometimes these and there is some irrative response, means negative animals, those which are positive, they will show negative response. Then regarding interpretation, there is less than 0.2 mm difference. If there is less than 0.2 mm difference, it is considered as negative. If the difference is between 2 to 4 mm, it is considered as suspected. But if uh, the skin thickness difference is more than 4 mm, it is considered as confirmed case. So this diagram is showing the sites for the intradermal tuberculin testing in camel. Next, please. Then we have also tested some of the serum-based tests that were available for use in cervids, and that is lateral flow assay-based test that contains that detects the antibodies for Mycobacterium bovis and Mycobacterium tuberculosis. Both these organisms they can detect, and this was available for cervids, but we found that in case of camel, this is also quite gives good response, because many of the camels which are which is having high burden of the tuberculous organism, they show RBPT negative results. Next, please. This is a animal side test that can be used under the field conditions. There is no requirement for cold storage of this kit, and only 5 microliter of the serum samples is to be put over one well, and on another well buffer is added, and after 5 minutes we have to look for the result. If the animal is negative, only one line will be red line will be apparent over the C. C means control. But if the animal is positive, it will show positive line over one or two, or sometimes on both these lines, faint lines they appear. That also gives indication that the animal is suffering from tuberculosis. The 1 and 2, they are for IgG and IgM, not for tuberculosis and bovis. Then regarding treatment, there are certain limitations, because in case of human being also, the treatment is very much difficult, and the isoniazid, which is reported to be effective in cattle, is not good, or it some reports even say that it is toxic for the camel. So it should not be used in camel. So I would like to suggest the use of two drugs, that is rifampicin and streptomycin, though I never came across any reference in which the animal was treated for the tuberculosis. But I came across one paper in which the animal was treated for the MAP infection, mean Mycobacterium paratuberculosis, means treated for the paratuberculosis, and they reported that this treatment regime is very much effective in case of paratuberculosis. So I hope this will also be effective in case of tuberculosis, because these two drugs, they are anti-tubercular drugs. So another important clinical condition is neonatal calf diarrhea. Though in camel calves, the diarrhea may be caused by E. coli, Salmonella, rotavirus, coronavirus, and even the pestivirus. All these organisms or bacteria and viruses, they are reported to cause calf diarrhea, and in some countries, rotavirus and coronavirus and pestivirus vaccination is also in practice. But here I will discuss about the E. coli induced diarrhea, which is very much common. Here, the clinical signs, they include yellow to greenish, reddish mucoid diarrhea. There will be anorexia, anemia, and the condition deteriorates so rapidly that the clinicians, they have limited time for their management, and the condition is often fatal. In postmortem examination, one may find congested and hemorrhagic intestinal mucosa with presence of yellowish or greenish watery diarrhea. The feces often contains mucoid discharges, and the culturing the fecal samples, one will get abundance of this bacteria. Though this is a normal commensal, hence the result should be interpreted carefully, and one have to ensure that the E. coli isolated is pathogenic. There are some virulent genes. Uh, if they are present, then only that E. coli strain will be pathogenic. Then in enterotoxemia, this is also very much common in young animals, and the disease is always is frequently fatal, and this occurs particularly whenever uh, there is a rain, or you can say humidity is increased, or camel is calf is getting access to some rotten and wet substances, or dietary substances. Then the clinical signs, they include depression, anemia, icterus, hemoglobinuria, and usually death occurs within 6 to 12 hours after onset of the clinical symptoms. And watery or bloody diarrhea may or may not be evident. The disease progress very rapidly. There is abdominal distension, colic, vocalization, and sometimes nervous signs, including convulsions, may be noted. And the death is often sudden. There is a sudden death. And in postmortem, one may record hyperemia and petechiae of subcutaneous tissue and pulmonary edema. Then in a small intestine, particularly in jejunum and ileum, congestion, blood-stained intestinal contents, and gas distension occurs. So these diagrams, they show the postmortem lesions in case of enterotoxemia. Then HS is also a common disease, which is often fatal. The symptoms are evident only when we go for postmortem, and the disease is caused by Pasteurella multocida. Though susceptibility of the camel for the HS is several times less than those in case of cattle. And scientists, they attempted to produce the disease in healthy animals, but they were not able to produce the disease, induced disease in healthy animals. And there's one school of thought says that this Pasteurella multocida is a normal commensal, not only in camel but also in other animals like cattle and buffalo, but their population is higher in case of camels. Then the clinical signs include respiratory distress, nasal discharge, high fever, congested mucous membrane, and edematous swelling in the throat and neck region. This swelling is rarely reported, but respiratory distress may be noticed, and soon after the appearance of respiratory distress, the animal lie down, and death is reported, and death occurs within few hours. So the predisposing factors, they include sudden variation in environmental temperature and relative humidity and stress. Then postmortem lesions, they include pneumonia, congestion and consolidation in lung, fibrinous exudate, and petechial hemorrhages, and they are evident throughout the lung and pleura. Then sometimes hemorrhagic enteritis is also recorded, but these chances are less. Then the lymph nodes, they are usually enlarged. Then the diagnosis, the affected animals rarely gives times for the laboratory examination. The clinician have to suspect on the basis of clinical symptoms, and the condition can be confirmed in postmortem examination. there is high fever, respiratory distress, and pneumonic changes in lung, and that may be appreciated by auscultation. They are suggestive, and the animal should be treated immediately. Then cultural isolation of bacteria or their detection in lung tissues on the basis of PCR test. They are the best considered for the diagnosis of the pasteurolosis in animals, and so is the case of is in the case of camel. Next. Then among coming to viral diseases, I will discuss only two diseases. One is contagious ecthyma and another is pox. Pox is caused by pseudocowpox virus. This disease have high morbidity rate, but mortality rate is very less. This is highly contagious in nature, and it is characterized by local swelling in the head and neck region. Next. So this virus is largely transmitted through the direct or indirect touch. The cut skin and abrasions, they while grazing on thorny plants, they facilitate the transmission of the virus. And their clinical signs, initially there is reduced appetite or starvation due to oral lesions. There is emaciation, anemia. In there will be facial swelling, and with this facial swelling, this is the first clinical sign which is apparent from a distance, and one may suspect that the contagious ecthyma has occurred. Then later on, the pox-like lesions develop over nostrils and oral commissures and lips. Then the lesions, they resemble very much to the pox lesions, and that can be differentiated only by the histopathology. Then intracytoplasmic eosinophilic inclusion bodies are also evident in post-mortem histopathological examination. So there is sometimes lacrimation also. Usually the facial region is the most affected region, and the disease has been classified into 5 different stages. In initial stage, there is erythema and papule which develops over the lips and other mouth parts. Then there is profuse swelling. Sometimes even the camel, they are unable to visualize the things. So there is severe facial swelling, particularly of the lower jaw. But this is edematous swelling, and if the swelling is severe, it should be managed with NSAIDs, or best one is or even steroids can be used. Prednisolone acetate can be injected to manage or to alleviate the swelling in facial region. However, this subsides gradually with progression of the disease, but this hampers the feed intake. So, if the condition is severe, the clinician should consider using the NSAIDs or even steroids. Then the lesions, they develop. Initially there is pustules that later on develops into a scar, and the size of the lesions, they are bigger than those recorded in pox, and this stage lasts for 4 to 5 weeks. Next. And in young animals, mortality may occur, and there will be severe oral lesions, and the animal may die. But usually the adult animals, they recover from the disease, and mortality rate is lesser in case of contagious ecthyma as compared to pox. Then this is these animals are in recovery stage. So gradually these lesions, they disappear, but yes, a scar is left. And at this stage, the animal is fully cured, but there are patches present over the skin in the neck region, and this usually takes a period of 11 to 12 weeks. Then coming to camel pox, though pox is seldom fatal in other animal species, but in case of camel, some strains they are highly pathogenic and they induce ulcers in gastrointestinal tract, and in infection with such strains they may cause mortality. So camel pox is one of the very important skin disease of camel. It is of significant concern because of high morbidity and um, high mortality also in occasionally. But this disease, in this disease, there is initially there is fever, then lymph node, there so enlargement, then skin lesions, typical pox lesions, they appear, and these lesions they are distributed over the leg area also. Next, please. So these you may appreciate that these lesions they are less severe in nature. Their size is also somewhat smaller than those present in contagious ecthyma, and the a small nodular growth they are um, present over the inner aspect of the thighs. That is the most common site. Then eruptions they later on appear on lips. Next, karo. And it may even extend over the eyes also. So there may be cloudy swelling in the eye. Um, the eye anterior chamber, aqueous chamber, that will appear hazy, and you may appreciate a small nodules that are present over the medial aspect of the thigh. Next. Then camel pox and outbreaks of camel pox and contagious ecthyma. In our country, um, it occurs almost every year because but the good thing is that once the animal is infected, they become immune. So those animals which are younger in age or they have never been exposed to the disease, they are usually susceptible. So the morbidity rate is usually lower. But if there is some herd and there is no um, occurrence of the disease in the herd for 4 or 5 years, then if exposure occurs, then all those animals which are naive, they show the symptoms. Then and there are several modern tools also for diagnosis of the disease like PCR. Based upon the PCR, we may differentiate camel pox from the contagious ecthyma because the clinical symptoms they are often vague and resemble. Next. Unfortunately, in our country, there is no camel pox vaccine available commercially, though we have synthesized the vaccine and it is available for us, but on commercial level, their availability is limited because the market is very low. So private companies, they usually hesitate to produce this vaccine commercially. But in Arabian countries, and I hope in Africa and several Asian countries, there are several kinds of camel pox vaccines. They are available, and primary dose is to be given at the age of 6 to 9 months. Then one booster is to be given at 4 weeks, and usually it is claimed that the animal after booster vaccination remains free from the camel pox throughout the life. However, this virus is rapidly changing its genome, and it may be possible that after vaccinating with one strain, the other strain may infect the animal. So this is in summary, we practice in our herd the management for optimizing the health and prophylaxis of various diseases. We usually administer vitamin A to pregnant animals because this vitamin uh, deficiency is frequently reported. Then we go for chemoprophylaxis against trypanosomiasis, seasonal spray of ectoparasitic infestations, then a screening for the trypanosomiasis and other endoparasites like that. So this calendar, it will vary from one country to another country. So with this slide, my presentation is over. And if there is any query, I would like to welcome you. It is so the participants may ask uh, if they have any doubt, or they can write in the chat box. Thank you for the nice comment from Kanta. Thank you very much. I think my topic is deep into the veterinary science, and usually so far as camel is concerned, we have to take little care of the healthcare, but still there are increasing evidences that this animal species is harboring several hemoprotozoan diseases without showing any symptom, and they may act as a source of infection for other domestic animals like cattle and buffalo. Say, for example, anaplasmosis. The animal rarely show any sign, but when we went for molecular studies, these parasites they are present. And from other several other countries also, the reports are coming that this is harboring many of the parasites without saying without showing any clinical symptom. And the vaccination schedule for the camel, yes, it is available. I will try to share with you, but that varies with one country to another. Usually, we require vaccination for camel pox. The vaccine is easily available. May go for rabies vaccination because many times the animals go for grazing area where rabid animals may bite to camel. So camel they are also susceptible for rabies, and they show usually the furious form. So once the camel is infected, it will start biting other animals also. In that case, one have to be very careful. So, rabies vaccination, the dose is similar, 1 ml. Subcut is to be given, and those available for use in dog, cat, or cattle, buffalo. We use the similar same vaccine killed one, so that can be used. And the vaccination, there is no schedule. We can inject as per our requirement, but for camel pox, as I mentioned, this is the most common disease and the with high prevalence rate in all camel rearing countries. So we may plan vaccinating for the camel pox. Another is brucellosis, but brucellosis the test the clinically or experimentally tested vaccine is Brucella abortus Rev 1 strain. So if that vaccine is available, that can be injected once at the age of 6 months in case of females only. So that is live attenuated vaccine that does not require booster dosing. Ah.
Uh, Thank you, sir, for the very nice presentation. And yes, the participants have started putting their queries. One question was any new technology. I think maybe they're asking in health aspect, is there any new technology? Uh, Is there any use of new technology from Khansa?
Regarding use of new technology, since the Camel, they are uh, largely distributed in Asian and African countries, Arabian countries, and new technology regarding healthcare, their use is limited. Particularly in our country, the market is very low, so the camel medicine, the traditionally used medicine, they are also not being used. So I have no idea about that. Hmm.
One question was any use of diagnostics. They asked, is there any previous one question was to use of the diagnosis? Maybe they're asking the availability of diagnostics or anything.
There are several Chinese firms and some Korean firms. They are preparing a special deep stick test for diagnosis of brucellosis in camel also. And for many of the diseases, for pasteurellosis or HS, they are now manufacturing camel specific kits also. So those are the modern kits, but their availability is the major limitation. On the uh, experimental level, there is so many developments, but on the field level, they are hardly available.
Thank you, sir. So, one participant, Dr. Ilkal Kebede. So, I'm reading your question. Currently, we are having multiple outbreaks of unknown camel diseases, showing several morbidity. Have you ever experienced this kind of incidences? The disease response to antibiotics shows sudden death, few respiratory symptoms like dyspnea, nasal discharge, and the like. Sir will answer that, but I really want that if you can turn on your microphone and come for a discussion, like virtual interaction, because it would be better through one-on-one interaction than you type it and we may not solve your whole problem. So meanwhile, I switched it over to sir kindly.
So these kind of outbreaks, they were reported from several African countries, and they are very well available in literature. And some of them correlate it with pasteurellosis. But there is one school of thought that strongly um, rejects this hypothesis. Means they said no, there is no pasteurellosis. But in these case of heavy mortality of unknown etiology, usually either some infectious agent is involved, pathogenic bacteria like Pasteurella multocida, or it may be due to toxicity. But since you are saying that they respond to antibiotics, means there is some bacteria that is involved. But till date, we are not able to pinpoint any other any bacteria other than the Pasteurella multocida that cause respiratory symptoms and heavy mortality in case of camels.
Okay, so what is the question from Kamalika? What is the recovery rate of contagious ecthyma?
Recovery rate is almost 100%. if the animal is 2 to 3 older than 2 to 3 years. Only the mortality that occurs in case of young animals, or previous if the animal is weaker one, or not in good condition, suffering from other disease, then only mortality occurs in case of contagious ecthyma. Otherwise, the infection or pathogen is usually limited over the skin lesions. There is no systemic involvement. But if the animal is weak, severely affected, immunocompromised, and we are not taking care them properly, then death may occur.
नीचे जाइए. Good presentation or excellence. Someone experienced serious network challenge. I'm hoping to have the soft copy of the presentation. Okay, we will share it. Then I have a question.
Any question?
Yes.
Yeah. Yeah, I'm Dr. Imtiaz from Pakistan. Sir, it was really a good presentation. I really appreciate you, sir, and your team, sir. And sir, I have a question regarding about the diagnosis of brucellosis. You mentioned that for PCR, you mentioned the tissues. Can we detect it from the blood for PCR?
ELISA and PCR kits, they are available in one of our institutions located in Bangalore. But that has not been, I think, commercialized. You are asking
And sir, talking about the PCR, in the diagnosis section, you mentioned that placental and fecal lungs tissue samples are required for confirmatory.
we usually take the placental tissues where there is necrotic foci. We collect a small quantity of the feces of the tissue, and another is the sample will be the vaginal discharges. In there, the bacteria is present in abundance. So, if you are taking the sample,
Thank you, sir.
Thank you, Dr. Imtiaz. Then one question from Amato Jetis. However, I have a question with regard to time needed before killing a camel for consumption after being recently injected.
withdrawal, this means the withdrawal period for any drug, for safeguarding the public health. Means if we are injecting ampicillin, we are injecting some other antibiotic, what should be the withdrawal period? That varies from one drug to another drug. If the drug is stored in fatty tissues, they may clear up. They may take even months together to clear up. But in case of triquine, if you are injecting, then that can be used after 15 to 21 days. There is no problem. The residual drug is almost clear. But for other antibiotics, withdrawal period varies from one antibiotic to other.
Okay. Then one question from Dr. Musa H. Darboe. Thank you, sir, for the presentation. How does a camel viral disease be transmitted through indirect contact? Like, I think in the case of MERS, it has got transmitted previously. So, can they transmit by indirect contact? Maybe indirect means maybe through air transmission or anything. So,
Regarding this, I don't have usually enough knowledge to comment on this question. Indirect question, to my knowledge, usually they are transmitted during the close contact. And tuberculosis bacteria, yes, there is droplet infection. So when they herd together, and usually the camel produces a peculiar kind of sneezing, during which a large number of droplets they are released in the environment, and the susceptible animal, if it is standing close to the infected animal, they may get the infection indirectly. And so that is the one example. But for others, I don't have so many knowledge.
The consumption of raw milk from tuberculosis animal.
It is not safe. Consumption of raw camel milk is never advocated. There are some published report wherein in Makkah and Medina they are offering the raw camel milk, and there is one published paper in my knowledge which has correlated the consumption of raw camel milk in Makkah to the occurrence of the disease in the person who consumed it. So likewise is for tuberculosis. There are chances if somebody is consuming raw camel milk and the camel is suffering from tuberculosis, they may get the infection. Though this is the unusual route of the infection. Through milk, the chances of getting infection is less, but not. But it is not safe. It may occur.
Question from Dr. Abdul Hamid Sauti Garba. So, do camels experience bloat, as in the case of cow, buffalo?
Yes, bloat may occur if there is some obstruction in the neck region, or sometimes if they consume urea-like substances, then the bloat may occur. But the chances of bloat is occurrence of bloat is lower. Higher is the incidence of impaction. So bloat, they do occur.
Then question from Dr. Timomi Amara. How experience in organic camel means maybe he's asking about organic camel farming. Is there
A camel, even when raised in natural condition, it is already organic one, because it is not consuming the fodder crops or substance from the ground where the pesticides are there, the fertilizers are there. They are usually grazing on, they are browsers. They browse on trees and bushes which are free from the other substances. But yes, for intensive camel farming, we require certain precautions if we want organic camel farming. Then another is that do camel suffer for PPR like disease? The clinical incidence is not very much clear, but some studies they suggest that PPR antibodies, they are present in camel. So it is suspected that they may act as carrier of the virus. Then do you get foot and mouth disease outbreaks? No, we do not get foot and mouth disease outbreak. The FMD lesions, though there is seroprevalence is there. There is seroprevalence, but the clinical symptoms are not recorded in single humped camel. But in double humped camel, there are few reports that they say yes, the clinical symptoms of FMD, typical clinical symptoms, they are recorded in double humped camel only.
so what okay, one of the participant wants to contact you for more detailed advices. Yes, Dr. Ilkal, you are always welcome for that. We have
We'll share the
yeah,
email ID.
yes, even in WhatsApp also, you got our contact details through WhatsApp or through email, you can contact. Then next from Dr. Kamalika, what are the reasons for liver necrosis in camel?
There are several, there may be several reasons. Then the most common cause is hepatitis. I would like to say infection. Then we cannot pinpoint that this is the most common lesion which is here. Yes, in liver, we sometimes we report the cyst or tuberculous nodules, and there are abscess also. Liver abscesses, they are very common in camel as compared to other animals. So the etiology, I have no detailed idea about that. But yes, liver abscess, they have been recorded.
Is anthrax from camel zoonotic and does it have high mortality in humans? Is it?
Yes, yes. Anthrax is always zoonotic, whether it is originating from camel or from some other species. And this is also a dangerous disease for human beings. If the systemic form occurs, one inhale through the respiratory tract, then definitely it will cause mortality. Though in localized lesions, if it is caused by the anthrax, then in case of anthrax, then it only causes the local lesions. But in systemic form, it is highly dangerous. Which is better for camel health, farm camels or free camels?
I think, sir, these farming related questions we can put to Dr. Ved Prakash, sir, after
Okay.
his.
Regarding organic camel farming, our next presenter, he will definitely present. So, respiratory disease like there, some of these questions we will और ऊपर करना जरा. Sir, for intradermal tuberculin testing, less than 2 millimeter has been written for negative test. Less than 2 millimeter, over 2 millimeter, if you are considering, here I would.
It is
Huh.
mentioned 0.2, but
Huh.
he thinks it is less than only 2. Means 0.2 and 2 is getting confused whether it is less than 0.2 or less than 2.
2 millimeter, 2 millimeter. If it is written 0.2, I am sorry. It is usually 2 millimeter. If it is more than 4 millimeter difference, then it is highly suggestive that the camel is suffering from tuberculosis. Here, I would like to share another thing, that the camel has been reported to harbor several other mycobacteria other than the Mycobacterium bovis and Mycobacterium tuberculosis. So, while interpreting there are now the scientists, they are saying that the positive test is always doubtful, because in some cases you do not get any tuberculin positive response, or even then there are several nodules present in the lung. Then this Corynebacterium pseudotuberculosis or some other bacteria, they also cause tuberculous like nodules in some vital organs, including the lungs. So we have to be careful.
What is about the regular annual routine vaccination? Okay, this question already has been answered. Regular annual routine vaccination means there is no such routine vaccination. It is as per your choice. Yes. Are there some common toxicities in camel?
Toxicities, I don't have any idea, because the camel, they are usually tolerant for many of the toxins, like nimbin toxicity that arises due to excess intake of the neem leaves. That is also is very much tolerant. But clinical toxicities, selenium toxicities, they have been reported in camel among heavy metal toxicity. So far, my knowledge is concerned, that is the only of clinical significance.
Thank you, sir. I think we should go for the next lecture of today's session. Yes, but I don't know whether he has connected. We will make sure we will wait for the next lecture, expert lecture, like next expert to arrive for the lecture. Hello, hello, Dr. Sham, sir.
Hello.
Okay, so
Hello.
yes, sir, you're audible.
Kindly allow me to on the video.
Miss Suman, no, not from here.
My voice is audible,
Yes, your voice is audible.
but I can't able to on this
Yes, sir.
video.
We are just okay. Ma'am Suman, are you present? Can you just allow the screen?
But no problem if it's
Okay, now
unable to start.
sir, we
Whether
can.
my slide is visible.
Yes. Your slide is visible. So just 1 second, I would like to introduce you. Okay, dear participant, the second expert for today's session is Dr. Shyam Sundar Chaudhary. He is agriculture research scientist in the discipline of veterinary medicine in ICR National Research Center on Camel. After his PhD in the discipline of veterinary medicine from Indian Veterinary Research Institute, he joined as a scientist in National Research Center on YAC, and after that he joined here. And currently, he is working on the therapeutic aspect of camel milk. Particularly, he is working on the project to evaluate the therapeutic effect of camel milk on dengue patients. So today, he is going to present dermatological problems of camel. So over to you, sir. Welcome to the session, and you can start your presentation.
Thank you, Dr. Swagatika. Good afternoon, all participants. Today we will discuss on dermatological problems of camel. As topic suggests, dermatological problems. Dermatological means skin problems or disease related to skins. So camel also get the disease of skins. Like the most important disease is caused by parasite known as camel mange. Other problem is caused by some viral infections like camel pox, contagious ecthyma, lumpy skin disease. Recently, we have seen outbreak in cattle. That also one or two incidents reported from camel also. Bacterial infections like contagious skin necrosis, dermatophillosis, and fungal infections like ringworm, skin candidiasis, skin tumors, bite wound caused by insects like bite and stings, or ill-fitting saddles cause saddle sore. And next one is skin abscess, chest pad abscess, and dermatitis means inflammations of dermis or skins. It may be due to allergic reaction, hypersensitivity, or any other infections or non-infectious origin also. So these are the some common problems of camels related to skin. First one is camel mange, sarcoptic mange or scabies. We all know this is a most common and important disease in camel caused by a mite known as Sarcoptes scabii. So it is a widespread and reported from many countries and highly contagious. Most of the skin disease we discuss are contagious in nature. So if one infected, one camel get the infection, he become a source of infection to others, or other healthy animal may get the disease from or infection from the infected camels. So it is contagious in nature. They are economic and genetic importance because usually the mortality rate is not that much high. Mortality is negligible in camel mange, despite the secondary bacterial infection is present. But they affect the economy of the camel husbandry. Means frustrating disease. So treatment of this disease is very difficult to remove from a herd. If one herd get the mange infestation, it is very difficult to eradicate from that because the spore remains in soil, and sometimes the healthy camels is also harboring the mite spore or mite in the dermis. So they also become a source of infection when they are immunocompromised. The one of the most common clinical sign is severe itching. If we are seeing any camel showing a skin lesions or severe itching is present, there is a chances of camel mange infestation. And the season, mostly the occurrence is seen in winter and rainy season. Is showing epidemiological or histological investigation of sarcoptic mange in camel. And in this report, they shown that 47.6% incidence rate. So once in herd, one camel get the sarcoptic mange, the total incidence they reported is 47.6%. In another study, they reported 28% of incidence of camel mange in herd. And in the further in one study from Eastern Ethiopia, they reported 31.5% prevalence of camel mange. Now coming to the etiology, what are the reason for this camel mange or sarcoptic mange? As we discussed, a mite, burrowing mite is responsible for this camel mange, and the transmission is usually by direct or indirect contact. Direct contact means healthy animal get in contact with infected, means infected to healthy, that is directly, then direct contact. In indirect contact means infected camel is source of infection, they lesions, the spore or mites come in soil or any equipment while they are due to itching, they are rubbing with wall or tree, and healthy camel come and scratch to the same site, then they will get the infection indirectly. Or the person handling the infected or diseased camel and without washing hand directly going in contact with this healthy camel, then there is a chances of getting infection through indirect contact. Mite, the interesting fact is that this mite can survive outside the body in environment or soil about 2 weeks. They prefer low temperature and high humidity as early infection is high. In this picture, you can see the mite under microscopic examination from skin scraping, the male nymph, female larvae. We will discuss in detail later. This is the life cycle of this mite Sarcoptes scabiei. You can see after the entering in the skin, the mite will lay, female mite will lay the egg, and these egg complete their cycle after a 1 month or 2 months. So this is a life cycle, whole life cycle of this Sarcoptes mite, how they are completing their life cycle in skin of camel. Pathogenesis, first pathogenesis is having 2 phases. First one is invasive phase. In invasive phase, the mite will invade or burrow in the skin using their hooks of leg or saliva. They will come inside the skin. After entering to the secrete some or their antigens, excretory or secretory and antigens will cause reactions, or host will react to that antigen. So allergic reaction will develop, inflammatory cytokines will be released, or due to these reactions, inflammatory cytokines, erythema, there will be a itching. The reason behind the itching or pruritus, severe itching is the release of these cytokines. This picture is showing the reaction, how the host react to the that antigens, different cytokines is released or immunomodulatory substance is released, and oxidative stress developed and systematic inflammation that result in development of signs after 2 to 3 weeks. Some studies has been conducted to understand the pathophysiology of this sarcoptic mange. This is a publication showing circulatory oxidative status in dromedary camel infested with sarcoptic mange. So the after coming inside the skin, they will cause oxidative stress and damage the responsible for the development of lesion. Now coming to the clinical signs, what are the typical clinical signs? So we can identify this disease from other disease, skin disease. The signs start in the armpit and groin region and spread to the rest of the body. One of the first sign is that the animal rub and scratch the affected area. Earlier we discussed after entering to the skin, they will cause inflammatory reactions and release cytokines that is responsible for the itching. Due to this itching, the animal or camel will rub their body with any object like tree or wall. Due to this rubbing, there is a chances of getting mechanical injury, mechanical lesions. Thereafter, the hair will shed, alopecia will develop, and skin become raw from scratching and begin to weep. Sometimes in severe condition, there is a chances of weeping of blood from the lesions. In picture, you can see how the Camelman's signs can be identified. Thereafter, scab will develop, crust will be developed in chronic condition. First one is in invasive phase. Second one is hyperkeratotic phase or chronic phase. In chronic conditions, due to immunity response from the host, the keratosis will develop. Due to this hyperkeratosis, the skin of camel from folded area will become thick. So the leathery, whitish, gray, thickened skin can be seen in chronic cases, wrinkled, cracked, as you can identify in this picture. Whitish, gray, thickened skin in chronic case of camel mange. Due to itching, camel will every time their focus will be on this rubbing and itching. Due to this anorexia, camel will not eat that much, lose their body weight, and if not treated properly, then secondary bacterial infection may be occur in those lesions, and that will be responsible for camel will become more susceptible to other disease like trypanosomiasis and pneumonia like diseases due to immunosuppressions. In herd, once one camel there is a chances of getting all herd is infested. Diagnosis, how to diagnose this camel mange? We will collect skin scraping from the lesion, outer border of lesion, deep skin scraping. We will scrape through blood till the blood will ooze out, and then put it on for the 10% potassium hydroxide on it, and then cover it with cover slip and examine under microscope. You can appreciate the Sarcoptes mite under microscope, how that mite will be seen. So it is a easy method that can be carried out anywhere. KOH and glass light. Other how we diagnose is based on history and clinical symptoms. Like the owner will report us that severe itching is there and history is present. Then from skin biopsy, the serology through ELISA, we can also diagnose PCR. In differential diagnosis, this disease is confused with camel pox, ringworm, contagious skin necrosis, and other skin diseases due to similar made it through diagnosis of skin scraping. In treatment, as I earlier discussed that it is very difficult and expensive to eradicate from the herd once herd is infested with camel mange, because the healthy animal or healthy camel is also harboring that mite. So first to identify and treat mange early and eradicate the disease completely, So to eradicate completely, it is necessary to treat all animal at the same time, including healthy animal. So infected and healthy animal both should be treated at the same time for prophylactic and therapeutic. Healthy animal for prophylactic purpose. Then only we can get rid of this camel mange. The move animal from the area where the infested camel are kept. Shear the animal and scrub away the crust. Spray the whole body with acaricide 2 to 3 times at 7 to 10 days interval. What are those acaricide can be used like Amitraz 250 mg per liter or 2 ml in 1 liter of water can be used to spray. Then Pintiofos 0.025 to 0.02%, 10 ml in 18 liter of water. Deltamethrin 1%. Butox solution is available to 4 ml per liter of water. Then the most commonly used and successful drug is ivermectin or higher version of this ivermectin is doramectin 0.2 mg per kg body weight subcutaneous route under the skin. It should be used for a higher efficacy 1 ml for every 50 kg body weight. So that life cycle of mite can be targeted. Another formulation can be also used and it is successful. We are using in our herd that is 6% sulfur powder in mustard oil. This formulation of 6% sulfur powder in mustard oil can be prepared and applied on the whole body of camel, including the part where the lesions present or parts or skin looks healthy, because healthy skins might harbor the mite. So we have to apply on whole body. These acaricides are poisonous, so we should take care of safety, wear the gloves properly, and store these acaricide away from the animals and children. Now coming to the prevention of camel mange. To prevent and control this camel mange, there is a necessity to isolate immediately the infected or infested camel. Isolation is necessary. Thereafter, cleanliness and hygiene of that avoid the infected herd and do not touch equipment or rubbing spot they may have come in contact with. Means those camels are kept in herd, so avoid contact with such animals. Provide the balanced ration to the camels. Spray acaricide in enclosure at regular interval to eradicate the mite. And as we discussed, it is some cases of zoonosis is also reported. So it is necessary to take care. In humans, it is seen that lesions are present on palm of the hand and between the fingers. So wear rubber gloves, wash your hand properly. So these you can notice appreciate in this picture how the prophylactic treatment against this mite is carried out by spraying synthetic acaricide. Some publications also reported the ethanol formulations for this camel mange be effective. Like this paper is showing in vitro acaricidal efficacy of using some plant formulations. And this is a publication showing evaluation of a neem Agaricta indica herbal formulation for management of sarcotic mange. Because the resistance against due to its unconventional or use, so it is necessary to develop a herbal formulations or alternative approach to treat this camel mange. Next disease of this dermatological origin is camel pox, also known as Chechek and Mata in India. This is a local name. So camel pox is highly contagious skin disease, as earlier discussed by Dr. Rakesh Ranjan sir about the camel pox and contagious ecthyma. Both are related to skin, so we will discuss in brief, not that much detail, because already discussed in previous lecture. These are highly contagious skin disease having high mortality and morbidity rate, and economic and genetic importance is higher and mostly affects the calf. These both disease of camel pox and contagious ecthyma is affect, and the season is winter and early season where the outbreak is noticed. Its outcome is either mild or severe form, and kill up to 30% mortality is recorded up to 30%. In mild course, usually confined to head or localized. In severe form, is generalized and animal, as earlier told by Dr. Ranjan sir, that animal will remain immune after once getting this infection. If recovered, it will be immune for whole life. These are the some publications about the camel pox, their status, epidemiology, and genetic cases from camel pox infection is also reported in India. So we need to take care while handling the camel pox virus is responsible for this disease. Genus is orthopox virus and family is poxviridae. It is a DNA virus, and transmission is direct or indirect contact. Direct in contact with infected animal, infected to healthy, and in indirect contact via any through contaminated object. And the source of virus is the crust and scab or lesions of that pox, lesions of the infected camel is the source of virus for healthy or susceptible animal. Clinical signs you can appreciate in this picture the how these papules and nodules developed, pimples like nodules developed on the skin, mild or localized, can be seen in old, or severe or generalized form is available in these young camels. So before skin signs seen, camel become depressed, fever is seen, is enter in the body from lymph node, it will go to the blood, and due to viremia, there will be a fever and depression, and animal will become anorexia, unable to eat. Initially, there is a one sequence of development of lesion in this viral disease, skin lesions. First, the small red pimples will be developed around the mouth, nostril, eyelid, lips, anus, genitals, legs, or inner side of, known as papules. These papules will convert into blister after filled with transparent fluid, known as vesicles. Fluid-filled cavity is known as vesicles. After some times, these vesicles get filled with pus. Pus means nothing, but these are dead cells infected with bacteria. Is known as pustule. After filled with pus, these vesicles known as pustule. These pustules, after some time, they healed and dried up and become scab. So these are the sequence of development of lesions in case of camel pox. As we know, in human also, we are getting a pox that is known as chicken pox. Chicken pox is due to herpes virus, varicella zoster virus. So, but in camels or animals, this is due to orthopox virus from poxviridae family. Thereafter, alopecia will be developed on lesions, and these skin lesions will attract flies. So there is a chances of development of maggot wound. Brain of internal organs will also develop a lesions, or sometimes due to will be developed and death may occur. Diagnosis based on history, clinical signs, and virus isolation is confirmatory diagnosis. For any disease, the isolation of pathogens or isolation of contagious microorganism is the confirmatory diagnosis. Test or ELISA. Then PCR, as earlier sir told that from PCR we can also differentiate between camel pox and contagious ecthyma. Immunohistochemistry, we can see the intracytoplasmic inclusion bodies, and then transmission electron microscopy. Through transmission electron microscopy, we can see the morphology of the virus particle and differentiate between parapox and orthopox virus. Differential diagnosis is necessary between these diseases due to similar clinical symptoms: contagious ecthyma, contagious skin necrosis, ringworm, mange. This is a picture showing transmission electron microscopy of the virus particles. A to E, figure number A to E is showing orthopox virus causing camel pox disease. And F is showing parapox virus, is responsible for contagious ecthyma. So based on the morphology, we can differentiate between these two similar diseases. Some studies reported isolation and characterization of these camel pox virus. So coming to the treatment, as we know, for viral disease, there is no specific treatment. We should follow the symptomatic treatment. Suppose skin lesions develop, so we go for the antiseptic. First, we wash these skin lesions and remove the hair and apply antiseptics like potassium permanganate solutions, boroglycerin, zinc oxide, povidone iodine, and if there is a chance, as we know, if once lesion is developed, there is a chances of getting secondary bacterial infection. To avoid that, antibiotics should be used. Then to reduce the irritation, itching, and inflammation, antihistaminic. Then NSAID to control the fever and inflammation. And most important thing to make sure that animal eat and drink properly. If animal is unable to eat and drink, then intravenous fluid should be provided, and camel calf should be encouraged. These are the treatment approach. For prevention, similar to camel mange in any skin disease, because of contagious nature, isolation of infected animal is necessary. Then vaccination, cleanliness, hygiene, avoid contact with infected animals, balanced ration, and as earlier discussed, but not followed in India. So as per the availability of vaccine in a specific country, the vaccine can be used. But one important aspect of this disease is that once infected, camel get infection and recovered, then it will remain lifelong immune to that disease. So the development of vaccine from the industry is very this nature of infection of getting lifetime immunity once infected. For traditional vaccination, the people using first they colored bottle in cool place and use these scab for vaccination in next season. Early in dry season, grind these scab and dissolve in the milk and rub these milk mixture into the scratches. So the healthy calf become immune or resistant to this virus. Coming to next, camel contagious ecthyma. The sign can be similar, but one important aspect or peculiarity is that the mostly lesion confined to the mouth. also known as contagious pustular dermatitis, scaby mouth, in India known as mumdi, are similar to pox. Mostly calf are affected. Early rainy season is the predisposing factor, and the lesions, as in picture, you can see pustule on lips and face. It does not usually kill, means mortality is very less, and recovered camel are immune. Etiology is camel parapox virus, genus parapox virus, family poxviridae. You can see in picture. Transmission electron microscopy. And the transmission is spread of this virus is through direct or indirect contact, indirectly through contaminated object, and predisposing factors are any injury near calf will start grazing thorn-like plants. So they become susceptible to virus. Clinical symptoms before skin signs, depression, fever, anorexia, pustular and lesion or nodule can be seen on mouth and swelling of head. The one important thing after getting infection, 1 week after infection, there is a swelling on head. So due to this swelling, they unable to eat or become anorectic or weak. Sometimes lacrimation is seen due to the infection in eye, conjunctivitis, watery eye. Initially, small red pimples. The sequence of development of lesions is same as a camel pox. So I will not go in this one. First papules, thereafter fluid-filled vesicles, and hello.
Yes, sir, you are audible.
Okay, thank you. So clinical symptoms are similar to camel pox and usually heals on its own by in 3 to 6 weeks. If secondary bacterial infection, then septicemia will develop or camel may die. And diagnosis similar to camel pox, history, clinical signs. One important thing is symptoms start can be outbreaks seen in start of rainy season. The lesion usually on lips and head swelling is present. Then virus isolation, serology, PCR, immunohistochemistry, and transmission electron microscopy. Differential diagnosis with camel pox, contagious skin necrosis, ringworm, and mange. You can appreciate in this picture the camel pox, contagious ecthyma, and papillomatosis. Camel papillomatosis is also a viral disease showing similar symptoms in mouth. Papillomatous lesions due to papillomavirus. Then specifically available for viral disease, so symptomatic approach, antibiotic to prevent secondary bacterial infections, antihistaminic, NSAID, or antiseptics on can be applied on skin lesions like potassium permanganate, boroglycerin, zinc oxide, povidone iodine, and calves are encouraged to suckle and treat the maggot wound if present. In prevention, no contagious ecthyma vaccine is available specifically for camel. Some claim that sheep contagious ecthyma vaccine is effective, but other scientists claim that it is not effective. And researchers are developing a vaccine against both camel pox and ORF cleanliness and hygiene, avoid contact with infected animals, balanced ration to the camel is necessary, and traditional vaccination similar to camel pox. Collect the scab, keep in bottle, and grind it and mix in milk and use it in next season to the healthy calves by pricking the lips and nose. Lumpy skin disease. It is caused by capripox virus and showing a lesion on skins and mostly affected the cattle. But in last year, 2 year back, has been recorded from the camel also, evidence of lumpy skin disease virus infection in camel from India. This is one report. Contagious skin necrosis, next disease, is caused by bacteria and also known as staphylococcal dermatitis because the responsible main etiology is staphylococcus. So known as staphylococcus dermatitis. In picture you can see in Rajasthani it is the local term is poda, contagious skin necrosis. Camel frequently suffer from skin necrosis, especially in crowded conditions. Affect camel of all ages, mostly young one, and camel may die from disease if they get septicemia. And fungi, actinomyces, Corynebacterium pyogen, Staphylococcus aureus, Streptococcus. These are the agent responsible for this disease. Transmission is direct or indirect contact because it is a contagious disease. Then clinical symptoms on neck, shoulder, wither, sides, quarters, and rarely on the lower legs can be seen. You can appreciate in picture. Alopecia is seen. A circular sore, a few centimeter in diameter, appear on skin. It begin to be fluid. So circular ulcer or lesion is a specific symptoms in this disease. Lymph node may get swollen. Camel try to rub and bite the sore or this ulcer. After 7 to 14 days, dead skin come off and open into the wound. Circular ulcer that does not heal can be noticed. Sometimes septicemia. And after healing, the star septic scar can be noticed. In diagnosis, history, can clinical signs, and based on history, clinical signs, we can diagnose this disease and differentiate from other disease like dermatophilosis, ringworm, mange, and confirmatory diagnosis through bacterial and fungal isolations. In serology, ELISA and PCR. Treatment: 100 gram of sulfur powder with 900 gram of Vaseline paste. We can prepare a paste of this and apply after removing the dead tissue from the lesions. We can apply this paste. And we can also use antiseptic like acryflavine, potassium permanganate, tincture iodine, and 50% of tincture of iodine and glycerin. Antibiotic ointment can be also tried and inject the broad spectrum antibiotic to control these bacterial infections. In prevention, isolation of infected animals, cleanliness and hygiene is necessary. Disinfect pen and surrounding area. Avoid contact with infected animal. Balance ration or add salt in the drinking water. Next one is ringworm infection. It is a fungal infection caused by dermatophytes. So it is also known as dermatophytosis, dermatomycosis. DAD is a local term for this disease in India. Mainly camels less than 3-year-old is mostly affected. And as many as 80% of young camel in herd may get infected. Reduce the animal value, but not its performance. This disease reduces the animal value due to skin lesions, but performance is not reduced. Usually heal by itself. So there is a not that genetic in nature. So human can also get infections. but that is not dangerous disease. Etiology is fungus, trichophyton, and microsporum. This dermatophyte is responsible for ringworm disease. They spread or transmit slowly by direct or indirect contact. The fungus spore may survive for months outside the animal, especially in rug, blanket, or saddle. Clinical symptoms, you can see in picture how ringworm, ring-like these lesions, circular lesions can be appreciated. Dry, hairless, circular patches with thick, scaly, gray whitish lesions, mostly on the head, neck, shoulder, legs, and flank. The patches begin small and about 1 to 2 centimeter in diameter. But as we seen in the males, there is a severe itching, normally recover without treatment. These are some photographs showing ringworm disease in camel due to trichophyton ringworm. And clinical symptoms as the lesions, how circular lesions is present, and then fungal spore under microscope. We can diagnose in laboratory through taking skin scraping, and by staining we can see spores under microscope. The next is fungal isolation and differential diagnosis with other similar skin diseases like dermatophylosis, mange, and contagious skin necrosis. Treatment, it is not normally necessary to treat because usually it heals by itself. Wash the patches with soap and water to remove the crust, or sometimes we can apply iodine solutions or tincture iodine or glycerin mixture. And we can also use a antiseptic solutions or topical antimycotic agent can be also tried. One precaution we take care in this camel is graciofulvin, one antimycotic agent used in other animal for treating ringworm is not recommended for camel because it may have side effect. Prevention, isolation, similar to other disease, isolation of infected animal, cleanliness, avoid contact, provide the balanced ration, use gloves while applying medicine, and wash your hand after handling the animals. India is Ticaria. It is a highly contagious skin disease of camel, mainly affect young camels of less than 1 year age. So if one camel calf is infected, the whole herd camel calf in nature. Etiology is a fungus, Candida albicans, as the term suggests, skin candidiasis, Candida albicans, spread rapidly by direct or indirect contact to all calf in herd. And clinical symptoms, you can see in this picture how symptoms appears. Lesions on skins appears like a broken pottery shard, means that pottery of soil, like hence camel herd, call it lesion on back near the hump, and later they become large and spread to entire body. The lesions are pustular and hairless. Alopecia is present, and after scratching, foul-smelling black-brown hairy scrap come out. Calf shows restlessness and itch. Diagnosis based on history and clinical symptoms, how the lesions present on the skin, and we can collect the skin scraping and see the fungus spore under microscope. Then fungal isolation is also a confirmatory diagnosis. In differential diagnosis from similar symptoms showing skin diseases, ringworm, dermatophylosis. Treatment, first we should remove the scab and hair, then apply antiseptic. 2% potassium iodine solution in clean water on the entire body every alternate day. We can also effective, and we must inject long-acting antibiotic to control secondary bacterial infections and apply a topical antimycotic agent. In prevention, the similar to other contagious skin disease, isolation, cleanliness, hygiene, disinfect pen and surrounding, avoid contact with infected animals, allow calf to suckle. Because although it is contagious, But when calf will suckle their mother, the adult female mother won't get this infection because they are immune or resistant to this disease. Mostly the ringworm, this skin candy disease is present in camel calf less than 1 year. Another precaution we should take care, use gloves, wash your hand well after handling the animals. Next disease is dermatophillosis. It is a bacterial skin disease of camel, matted and encrusted hair present on the skin, mainly of young camels, rarely in adult. It is also a zoonotic in nature. Etiology, fungus-like bacterium Dermatophilus congolensis is responsible for this disease. They spread slowly by direct or indirect contact and mostly seen in rainy area. In clinical symptoms, you can see in this picture, these pictures that swollen red skins and begin to weep, fluid dry, forming a characteristic crust in these legs, white crust you can appreciate. Then mostly the base of neck, flank and legs lesions are present. In diagnosis based on history, clinical symptoms, skin scraping by gram staining, we can see this bacteria, Dermatophilus congolensis, is a gram positive anaerobic bacteria that can be seen after gram staining, and the bacterial isolation for confirmatory diagnosis is necessary. In differential diagnosis from similar other diseases of skin like ringworm, mange, contagious skin necrosis is required. Treatment usually not necessary because they lesions heals in 4 weeks without treatment. But if not healing, then we should apply antiseptic or long-acting antibiotic and antimycotic agent to control other secondary infections of fungus and wash the sore with iodine solutions. For prevention, the similar to other disease, so I am not going to discuss here. Some other dermatological problems, these, whatever we have discussed, these are the common major disease present in camel dermatological problems, but some also encountered in camel like skin tumors. So tumor, as we know, it is a neoplastic, in nature neoplasm, we can see uncontrolled growth of the cells. So here we are not going to discuss. Bite and wound caused by insect. Due to bite of insect or any sting, there is a immediately after bite the hypersensitivity, and due to that hypersensitivity allergic reaction is happens, and erythema and red pimples and papules can be seen on skin. So immediately we go for the treatment. If severe hypersensitivity, then corticosteroids should be given. Otherwise, we can go for anti-allergic substance or anti-allergic drug like Avil. Then ill-fitting saddles cause saddle sore. We will discuss here in next slide. Skin abscess, chest pad abscess, and dermatitis. Dermatitis is a inflammation of dermis or skin that might be due to allergy, hypersensitivity, or due to any allergen or infection or non-infection, any origins. We can see the dermatitis or skin lesions. Then dermoids. Saddle sore. First we discuss saddle sore. Saddle sore is also known as saddle gall. In India, pilan ka ghav. This is a local term. You can see in this picture that the in throat, usually it occurs in throat. So this saddle, when we apply the saddle, due to this pressure of saddle, there is a chances of getting wound. So this is nothing but it is a raw, dry, cold skin. Then they may drain pus due to this saddle, pressure of saddle, and they develop a wound. It is very painful. So treatment is required. First, drain out the pus, remove the dead tissue, and put magnesium sulfate powder in the hole of this wound. And put, you can also use a 0.1% solution of potassium permanganate and other antiseptic. We must use fly repellent or antibiotic and rest should be provided to this dermoid cyst, also known as dermoid cyst. So these are non-contagious in nature. They are not contagious. You can see in this picture that dermoid cyst present in neck region. Usually the egg-shaped painless growth on ear and neck can be seen, known as dermoid. They spoil the look and lower its value. This economic purpose. So treatment is usually not required because it is harmless and not causing any harm to the camel. But sometimes if owner wants the treatment, then surgery, we can remove this dermoid cyst through surgery. Skin abscess and chest pad abscess. The more common cause for this abscess is bacteria, thorn, sharp stone on the ground is responsible for this abscess. Abscess or pus surrounded by inflamed tissue. Abscess is nothing, but it is a pus or dead tissue surrounded by inflamed tissue or bacterial infection is known as abscess. These are painful, inflamed swelling, often hot. The abscess may break open and releasing yellow, creamy pus. The location anywhere on the body, mostly on the head, neck, chest, pad, saddle, and feet. You can see in this picture the necrosis on external pad of the camel. The treatment is first we should drain out the pus and remove dead tissue and then apply antiseptic solutions and antibiotic. Thank you. Thank you very much.
Thank you, sir, for the detailed presentation.
Physical problems of the camel.
So we are having some questions from the participants. Heminder, please switch in the charts.
Okay.
So go up. Okay.
Tick-borne disease like from this question, are tick-borne disease like filariasis and babesia seen in camel?
Yes, yes,
No,
sir.
that is not related to dermatology, but also yes, the filariasis and babesiosis can be seen in the camel also.
Then next, if possible, can you send, okay, presentation will be shared after all the sessions are done. Can the external diseases transmit by milk? The question is,
External disease means which disease? From camel milk, if the any microorganism present in milk can be transmitted to other humans or other. In case of this viral disease, camel pox, the pox virus is present in infected animal secretions, so that they might present in this milk also. So from that milk, healthy animal may get this virus. So disease can also be transmitted in milk if microorganism is present in that milk of infected animals. It depends on microorganism or pathogen.
yes, sir, how to differentiate between contagious ecthyma and camel pox?
First one is clinical symptoms. In case of contagious ecthyma, the lesions mostly present on the face, lips, mouth. And second one is edema of the head, swelling or edema of the head. This is one differentiating feature. And second one, based on the diagnosis, is we must go for this PCR based on molecular tool like PCR. And another one is transmission electron microscopy. As I shown in the picture, from transmission electron microscopy, we can differentiate both virus based on the morphology, because the etiology for both camel pox and contagious ecthyma is different. Camel pox is caused by orthopox virus, but camel contagious ecthyma is caused by parapox virus. So both virus morphology and size is different, can be differentiated through transmission electron microscopy and further through molecular investigation like PCR or isolation of DNA virus, then sequencing.
Okay, then
But in field condition, it is difficult to differentiate both disease because both disease mostly affect camel calf and lesions is also similar. But the one difference is in Cantarsi face is commonly affected.
Okay, sir, what about the resistance of the camel to diseases?
Camel is naturally habitat of camel is naturally a desert, so either cold or hot desert. So they are immune or resistant to many diseases. But now, due to change of climate, or camels are getting in contact with other animals, so they become more comparatively from earlier. They become more susceptible to the different disease. And now, as we discussed, lumpy skin disease also reported from camel, and other as we discussed in previous lecture and this lecture also, the many disease has been reported from camel. But compared to other animals, yes, camel are more resistant.
Yes, we can say for most of the diseases, it acts as a carrier or reservoir host.
Yes, definitely.
Clinical symptoms.
Compared to other animal, they act as a reservoir.
Okay. So thank you, sir. We got so many appreciation for your lecture. And dear participants, for today, we are done with the presentations. And okay, one more question we got for LSD control in camel, whether provide vaccine in India. So right.
No, yet no vaccine used in camel in India. That one report, as I shown in this presentation, is from India, but not that severe outbreak happened in camel like cattle. So no vaccine has been used yet.
So thank you, dear participants.
Thank you so much.
Thank you, sir. So today, here now only we are closing the session, and tomorrow at Indian Standard Time 2 p.m. we will start the sessions. So thank you everyone. Thank you for today.